Welcome. My name is Dr. Martin Whittingham, and I'm the past president of Division 49 of the American Psychological Association. And today I'm going to be interviewing Dr. Cheri Marmarosh. Dr. Marmarosh is a well-known author and researcher on groups and group psychotherapy. And she's going to talk to us today really about the impact of the pandemic on groups and on connectedness and what that really means. So, Cheri, welcome. Glad you could be here.
Thank you.
So what do you think is one of the most challenging aspects of the pandemic when it comes to groups?
I think one of the most challenging things is the social isolation. I think that is the one thing. I think being asked to stay indoors, to reduce our social contact, to not do a lot of the social activities, go to a lot of the sporting games, do a lot of the fun things, go to places of worship, to isolate ourselves is one of the hardest things. And I think we're social animals. And you and I both do a lot of group research and group work. And so we know that, from the time of birth, we're a part of a group, a family, a community. And so, it's social to one. I think it's really the root of some of the ambivalence that people have experienced into wanting to not stay away and to kind of follow these recommendations, is that it just goes against everything that we do. And so I think one of the side effects of that is going to be a lot of loneliness, that people are going to experience more loneliness, more detachment, more isolation.
Mm-hmm. So what do you think is the impact of that kind of loneliness on people's ability to sort of function in different areas?
Yeah, it's a good question. There's so much research now on loneliness and the impact of loneliness. We know from like a physical health perspective, chronic loneliness has been linked to a shorter lifespan. It's linked to cardiovascular disease, so increased risk of stroke and heart attack. We know that it's increased risk of cancer and inflammation. We also know that it's linked to cognitive decline. So people with Alzheimer's who are more alone, like the elderly, do worse when they're in a state of chronic loneliness. So the disease progression is quicker. And so we know that from a physical perspective, we know that chronic loneliness is related to increases in cortisol, which is a stress hormone, which is linked to long-term health issues as well. So those are the things we know, and especially in a time where we want to stay healthy and fight infection, we know that chronic stress and loneliness is related to immune functioning.
Right.
We also know from the mental health perspective that chronic loneliness is linked to depression, anxiety, suicidal behavior, suicide. We know that it's linked to eating disorders and increased use of food to cope. We also know it's related to substance abuse and both alcohol and drug use. And so we know that this loneliness, and I do want to highlight, the importance of when we think about loneliness, you can be in your house with lots of people around you and still feel very lonely. Right. And you could be alone in your apartment and feel very happy. So loneliness is your own internal experience of how you feel connected to people.
Absolutely. So, we know that groups can be very helpful. The research on this is very strong. So can you tell us a little bit more about how do groups help?
Right. There's so much research, and we've been actually doing some of that research. I've been studying groups for a long time. And from a social psych perspective, we know that groups are related to a sense of belongingness. Right. They relate to increased self-esteem. So a lot of people who, if you're a part of a team, so a lot of people are different fans of their teams. That enhances our sense of well-being when we're a part of a group and we feel a sense of community with our group, connection to our group. A lot of us have a strong sense of group identity. We get a sense of who we are from those groups that we belong to, and even a sense of hope for the future, like a hope for ourselves. It can lead to hopefulness. And from a clinical perspective, we know that group therapy has been really effective equally to individual therapy at treating and helping people with a wide range of issues, from anxiety to eating disorders to substance use. So, belonging, connection are all really critical to our well-being, and groups really provide a sense of hope and cohesion and identity for members.
Yeah, I mean, absolutely. So where do people go online right now to get connected? What would you recommend?
There's so many resources right now, and most of the groups are online. So if you do a Google search, which I did, you can find lots of different links to different groups. There's lots of, whether there's social groups, so if you're interested in a certain hobby or books or sport or activity, you could find those kinds of groups online, and they're meeting in different locations. You can also find links to support groups. So right now, in the state of New York, there are a lot of free online groups, support groups for people who are struggling now with the virus. So there are a lot of different ways to do this. I think you could do it on your phone, you could do it on your computer, depending on your technology. But I think there are a lot of resources out there now for people looking for online groups. If there's an issue with substance abuse, AA has a lot of online support groups right now running as well. So there's a lot of opportunity to get involved in groups by searching.
So you spoke about Alcoholics Anonymous, because in some cases we do have more needs than just getting support.
Right.
What would be your recommendations in terms of people reaching out for that kind of help online?
Reaching out for more psychotherapy support. My recommendation for people, if you're looking for something more than a support group or just a group for social connection, is to look for certified group therapists. If you're looking for a therapy group, I think one of the searches you could do are through local organizations. So you could look at agpa.com, the American Group Psychotherapy Association. You can also look through Psychology Today, and based on your location, you could find group therapists. If you have insurance, there are different ways that you could get connected from in network. You would look online or call your insurance company and find out which therapists are in your network. You can also look at local community mental health clinics. So for example, I'm part of the George Washington University, and we have the Center Clinic, which reaches out to underserved populations in DC. So if someone didn't have any financial resources but wanted to get involved in psychotherapy, they could call our clinic, and we're shifting all of our mental health services to online. So we offer online groups and online individual psychotherapy as well. So there are places to look.
Terrific. So, what would be your three sort of take-home messages from this?
Yeah, I'm glad you asked that. The first one I would say is that this situation is unlike any other situation we've seen. And, a lot of people are dealing with incredible losses, incredible both health losses, loss of loved ones, but also financial losses. People are staying home. They've lost a lot of their resources. It's very stressful. So I would have a lot of self-compassion for some of the struggles that we're going to be dealing with in the upcoming months. And that it's very normal to feel anxious. It's very normal to feel some depression with these losses. And that we're not all going to, be on our best at every day. That this is something that needs a lot of, it's going to take time, and it is very difficult to get through. The second one is that if you reach out to people, groups really do help. I mean, I think they do offer that kind of support. And if you're not getting that support in your home, there are other resources outside the home to get that. So I would really encourage you, whether it's Zooming with friends and getting them online, whether it's FaceTiming with your parents or elderly people in your community, whether it's getting onto some of the online groups for interests or hobbies that you may have. I think those are really important things to do. And the third one is, if you or a loved one is struggling with anxiety or depression and you feel more concerned with their well-being, that there are places to go. You certainly could call the crisis center to evaluate whether or not someone needs more serious intervention, but you can also look for some of the therapists online that are doing online telehealth therapy. And I think it's really important to be able to get those resources. You still can get them. So if you can't drive to see a therapist, there are people doing this kind of group therapy and individual therapy online. And I can say, as a therapist, I've been working in the field for 20 years, and I do individual, group, and couples work. And for some of the issues that we're really struggling with right now, I can't say enough about how group therapy helps. I mean, I think, groups are providing something that you really, that sense that you're not alone in this, and to talk to people who are also going through the same losses that you are or similar experience than you are. Group therapy really provides that kind of cohesion and that sense of belonging that people are really lacking these days, and really can help you get through some of these hard times. So the thing is a self-compassion, reach out to people, don't feel so isolated, do something to try to connect. And the last one is really try to get help if you can. And group therapy is one of those places you can get it.
Terrific. Well, thank you. And thank you for watching.
Thank you, Martin.